Hey everybody, this is Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. This week we're going to basically jump off a picture that we took on Instagram last week that shows how we use specialized tools to address carpal tunnel syndrome. So carpal tunnel syndrome is something we see very frequently in our clinic. It's a very common diagnosis. Basically what it is you have these 8 little bones in your wrist here, and they kind of make a cup shape like that. And then you have a soft tissue ligament that goes over the top. Now what happens in carpal tunnel syndrome is that you have a nerve that goes through that tunnel, and the tendons that surround it can either become inflamed, or these bones can basically collapse and put pressure on that nerve, and then you typically get tingling and numbness. So one of the things we do besides our specialized extremity adjustments that address the function of these joints is we also use some specialized soft tissue tools. Now this is one of many I use in the clinic, but basically what they're designed to do is break up soft tissue adhesions, maybe even scar tissue from old injuries, but works really well around that tunnel area. So on Sarah's wrist, I'll kind of demonstrate what it would look like. So kind of anatomically what we're talking about, that carpal tunnel is more or less right around here. And the different tendons that come in from your forearm create fascial planes that kind of stretch in here. There's something fancy called an aponeurosis as well. So these specialized tools can kind of get in those nooks and crannies of where you develop adhesions and restrictions in here, and that could essentially work on compressing this wrist to where you would have those tingling and numbness sensations. Carpal tunnel is something very, very commonly diagnosed in people that do repetitive motions, like office workers or people that like to knit and sew, even construction workers that use screwdrivers, hammers. Just that kind of repetitive motion can really set you up for having an inflamed carpal tunnel area. So this is something we use regularly in the clinic. We find a lot of benefit with it along with the adjustments that we do, and at the end of the day tend to get a lot of good outcomes as a result of it. So hopefully this was a little more descriptive for you guys. If you had any more questions in regards to these tools or how we would address something like carpal tunnel syndrome, please make sure you get a hold of us. Again, I'm Dr. Kyle with Columbia River Chiropractic. Thanks for watching.